Hi, everyone. Dr. Ellie here with the I Heal Kids podcast. I'm the founder of Middle Path Integrative Pediatrics in Asheville, North Carolina. I also serve people throughout North Carolina, California, South Carolina, and Florida for functional medicine consulting. So check that out as well on my website, middlepathintegrativepediatrics.com. Well, I'm here today on a podcast that's been inspired by my patients. So for whatever reason right now, I have a lot of infants in my practice. And infants, for those of you that don't know, or may have forgotten, do some really weird things. And a lot of them can be normal, but also really concerning. And so I just want to demystify all of that for you guys and make sure that you guys know when to be worried and when not to be. And of course, this is educational, so should not be construed as medical advice. So please reach out to your local provider. And if you have any questions, definitely make sure you're getting medical advice. So spitting up. Okay, I get this question all day long, every day, yesterday, today. Spitting up. Okay, babies do spit up a lot. And the reason for that is that they have a stomach that's a little bit more vertical than horizontal, and it sort of rotates over time. And they also have a valve that sits near the stomach that helps kind of keep all the fluid in. But in newborns, it's not very mature at all. And so for many newborns, you have this like all liquid gut diet, and then you've got this vertical tummy, and then this tummy that's, it has a valve that doesn't work particularly well. And so everything just kind of comes up. Now, in general, this isn't too much of an issue, especially if it's not more than, a few tablespoons at a time, which, by the way, pour a few tablespoons of breast milk or formula if you have it to spare on a table, or just do it with colored water and see how much it is, because it's pretty shocking the amount that will flow everywhere. So you may be thinking that it's more than a few tablespoons when actually it's really not. Other things to worry about would be if the spitting up is extremely forceful. So a lot of people go on the internet and they read, projectile vomiting. This is like something that people come into often worried about. And by all means, if you have questions, please do, because I always want to know about that if it's a concern, because it could be something more serious. But projectile vomiting, it's not really when babies are just kind of spitting up and it gets all over your clothes and everything like that. It's much more forceful, and babies will repeatedly do it. And it's an indication of something called pyloric stenosis, which is a very severe condition where the pyloric sphincter, is thickened and too large, and it can cause a lot of problems. And babies can get dehydrated. They can get, God forbid, into shock. If they have that condition, they definitely don't feed well. They may not gain weight. It's more common in firstborn children and male children. I'm not sure why, but we definitely do want to know about that if you feel like your child could be having projectile or very forceful spit up frequently. Another thing to worry about would be if the spit up isn't just milky. So now you're seeing like a fluorescent green color, God forbid, like red, like blood, or coffee grounds. Coffee ground color is another indication that you could have blood in the vomit. So obviously that's a concern. And fluorescent green can be a concern because that can actually be a sign that your baby is spitting up bile. And those things are things that, we want to see right away to make sure that we don't need to do any imaging or further workup to make sure that your baby stays healthy, because obviously spitting up blood and spitting up bile can be indications of things that are more severe, like a bleed, like what's called a malrotation or a twisting of the intestines, things that we really need to look into. Another thing to think about is blood in the stool. So now sometimes this happens in newborns that are allergic to dairy. So if mom is breastfeeding or the birthing parent is breastfeeding and taking a lot of cow milk dairy or really any mammal dairy, some babies will get some blood in the stool, and then eliminating that will be helpful because babies who are allergic can have inflammation in their gut lining, and that causes a little bit of blood. So we want to eliminate that allergy. But there are other things that can cause it too, right? God forbid, some kind of bleed in the lower intestine, hemorrhoids, and then constipation can do it as well. So if a baby actually has a poop that's so hard and large that it causes a tear or a little fissure in that anal area, that can cause blood as well. So I just want to make sure, if you are seeing blood in the stool, do come in, chat with us about it. May or may not be a true emergency, but we definitely want to hear about it. Obviously, if you're seeing copious amounts of blood, please go immediately to the ER. Another thing to worry about would be anytime that your child is having, God forbid, difficulty breathing. So they've spit up and now maybe they've aspirated, meaning the fluid has gone in and down into kind of their lung area. And that's really dangerous because that can cause things like pneumonia, obviously gagging and choking. It could indicate like an anatomic issue with feeding and swallowing. So there's a lot of reasons that we would want to know if you're seeing anything like that. So make sure that you do, if you're seeing difficulty breathing, definitely call 911 and get that sorted out. Other things to kind of think about that may be a little less severe, but as a general pediatrician, I definitely want to hear about. If your baby's crying more than 3 hours a day, that could be colic. So babies that are really struggling, most babies, by the way, do have kind of a witching hour in the evenings where they cry and fuss, and it's always when you want to go to sleep and you're just done and they're up. But if it's really excessive and they're really uncomfortable, they could be colicky. They could be experiencing reflux, which is where the stomach acid comes up and creates a kind of a burning pain in the esophagus, the feeding tube. And that can be really uncomfortable for babies. And babies that have reflux sometimes will arch. Now, I should distinguish between reflux because I'm saying it as reflux and reflux disease. So there is a distinction there. So babies that have reflux where they're just spitting up, that can be normal. So it's just coming up, they're happy, they're gaining weight, they're not refusing their feeds, they're looking healthy. That can be normal. But reflux disease where they're having pain, they're not gaining weight, they're refusing to eat, or maybe they're even eating a lot and you're just like, gosh, they're just never seem satisfied. That can be all a sign of reflux disease. So we do want to talk about what to do. And if you are experiencing reflux, some of the things that you can do would be holding them upright after feedings, or, if you're not worried about them spitting up in the swing or the car seat, you could put them there as well for, 15 or 20 minutes after feeding. However, it does get a little messy if they spit up. And that helps to kind of keep all of the milk down. So, if you're thinking there could be some reflux, that could be something that you could try at home. You can also put the feeds closer together so that they're more frequent but smaller. And then pace the feeds as well. So meaning pop the baby off the breast or the bottle and go ahead and burp them. And take more frequent breaks, because sometimes babies just need a minute to let the food kind of go down, and they may be having a really strong suck, or sometimes the breastfeeding parent can have a really strong output of breast milk, really forceful milk letdown that can cause, some kind of the baby needing to swallow quickly to get the food in. The other thing that can happen is that the nipple flow on the bottle can be too big. And so that can cause kind of this sensation of like sort of swallowing. So this would be the same as like, if someone went out to a restaurant, they're gobbling their food and all of a sudden they're like, oh, I have a little bit of heartburn. That's kind of what we're thinking about here with babies. So we just want to slow it down, make sure you're using the right nipple on the bottle. If there is forceful milk letdown, pacing the baby, or even sometimes hand expressing a little bit of milk to release the pressure at first can be helpful, just to avoid all of that. Last thing would be, I guess not the last thing. There's always so many things you can do in holistic health. But another thing to think about would be thinking about allergens. So if there's something irritating your baby, and it may not actually, now that I'm talking about it, be an allergen like we talked about earlier, like the cow milk protein. It could even just be gassy foods that's creating gas in your baby and they're just a bit uncomfortable. So things like broccoli and cauliflower and onions, if you're noticing your baby's really gassy and uncomfortable with those foods, just go ahead and try off of them for a few days, see how your baby does. Absolutely don't want you eating nothing. So if you feel like you're eliminating everything from your diet and it's not working, please come in. Probiotics, we're still in the research phase with all of that. There's been some research that Lactobacillus reuteri may help with colicky babies. However, if your baby's premature, very sick, has an immunodeficiency, there can be reasons that we don't want to use a probiotic. So definitely discuss that with me if I'm your pediatrician or someone else if not. And let's talk about normal feeding. Since I talked a ton about feeding and problems with feeding, what is normal? How often do babies even need to eat, right? So let's back up to that. So the basic rule of thumb is you want to feed a baby every time they are hungry. So it sounds really silly to say, but especially newborns. Sometimes newborns will do something called cluster feed, where they're feeding very, very frequently for short periods of time, very often. And then in general, they'll start to space that feed out a little bit. And newborns, breastfed newborns will usually nurse more or less every 2 hours. So 10 to 12 sessions in 24 hours is kind of the norm. And then over time, we space this feeding out. But it's a slow process, right? So most breastfed infants only take 1 ounce in the first few weeks. And the amount, increases over time, but slowly. And it tops out about 4.5 ounces at a year of age, so per feed. Now, every baby's a little different, depends on their growth, their development, and size. So your pediatrician should be tracking, all of that. Bottle-fed babies. Most bottle-fed newborns will feed every 2 to 3 hours, so 8 times is generally recommended. Again, all babies will differ a little bit. But your newborn may only take a half an ounce of feeding for the first day or two of life. But after that, they'll generally drink 1 to 2 ounces at each feed. And by the end of the first month, babies generally consume 3 to 4 ounces per feed every 3 to 4 hours. To kind of give you a clue as to where you're going, by 6 months, it's generally 6 to 8 ounces, 4 to 5 times a day in 24 hours. And at 6 months old, you may also be introducing some solid foods. And by solid foods, we generally doing puree, unless your baby's doing baby-led weaning. But that is definitely another podcast that I will add to my list. How do you even know if your baby is hungry? Good question. I mean, if you've never had a baby before, they're kind of like little aliens or something. They do everything a little bit different and it's hard to tell. Well, things that you can sort of look for are their hunger cues. So they may be licking their lips. They may be sticking their tongue out. Oftentimes they're rooting. And so rooting is a reflex that babies have where they move their kind of jaw and head and mouth against, they're kind of like searching for a breath. So if you see me on YouTube, they're sort of moving their head in, they're sort of cuddling in, looking for that breast or, in some cases, the bottle. If they're putting their hand in their mouth repeatedly, they're opening their mouth, they're fussy, they're sucking on everything. Those are all signs too that your baby may be hungry. So it would be a good time to try and feed. So I get a question a lot about how do I know if my baby's getting enough? And so not everyone is doing a transfer weight at home, which is, a pre and post breastfed weight or bottle fed weight. And there's a lot of issues with that anyway that we can talk about. But, how do I even know? Is my baby okay? Or, do they need more or less? Who knows? Well, some of the things we just look for is your baby gaining weight? So simple as that. You'll come in and have your baby weighed regularly with me. And usually I'll do that at 2 to 4 days of life, 2 weeks, 1 month, 2 months, unless there's something that I'm worried about. Then I'll have you come in more often. Some people do have scales at home, and that's helpful, but keep in mind that your scale at home is going to be different than the scale in your doctor's office. So there may be some slight variations. So something that I really like parents to do is just simply look at the diapers. So is your baby having plenty of wet diapers? Are they stooling regularly? And also, are they staying hydrated? So is the inside of their mouth nice and wet? Do you see a little bit of drool? Their lips aren't getting chapped, although they can develop a suck blister right here, and that's normal. So just keep in mind. So look for the output when it comes to, is your baby getting enough food? Sleep struggles. Let's just talk about the newborn sleep basics first of all. So newborns should be getting about 14 to 17 hours of sleep in 24 hours. They sleep a lot. And thank goodness that they do, because parents really do need to try their best, even though it's really difficult, to use that time to sleep themselves, to take a shower, to eat, to really, have that self-care as much as possible in the newborn period is so important. But keep in mind that every baby does have a different sleep pattern. So some start to sleep through the night. And by the way, through the night means 5 to 6 hours at a time. So it may not be that beautiful 8 hours that you're really hoping for. And that's by 2 to 3 months of age. But some don't. And all of that is completely normal. A little word on safe sleep. Now, there's a lot of varying opinions on this. As y'all know, if you're listening to me, I tend to be very much in the middle path integrated pediatrics, infusion of conventional and holistic medicine. I kind of enjoy that middle of the road place. And in this case, I think it's really helpful. So co-sleeping. So co-sleeping is in some cases easier for people because the baby's right there and they can breastfeed and they feel bonded and attached. But here's the thing, you guys. The Western bed wasn't really developed for co-sleeping. So there's sheets and there's pillows and there's, I don't know what's on my bed is my blanket and my throw pillows and my regular pillows, and half the time my dog's on there. It's kind of a hot mess. And babies can really easily become tangled in that. Not to make the podcast a downer, but I have seen some bad outcomes from that. And by bad outcomes, I mean bad things happening to babies. So I think a really elegant solution is just get a bedside sleeper. So if you're not wanting to do a bassinet, which is also fine, just in your bedroom, a bedside sleeper is a great way to kind of mitigate this safety issue with sleeping in a Western style bed, and also having your baby right there for breastfeeding, feeding, and bonding. So I really do recommend just go ahead and look into one of those. And that way we can avoid, the baby accidentally getting rolled on or, God forbid, trapped in the blankets. As a side note, never ever sleep with your baby on the couch. I did have a very sad patient who got stuck in the couch cushions, and you can imagine that did not go well. It does happen. So please don't do that. And not that anyone is ever doing this, but please don't do drugs or drink and then co-sleep with your baby. It's just so easy to, when you're intoxicated, to accidentally roll over them or on them or not really realize, that they have certain needs. So avoid that as well. Okay, bedtime. I get this question all the time. How do I know if my baby is tired? What do I do? So sleep cues. If you notice your baby is yawning or they're stretching or they're kind of rubbing their eyes or their ears. And by the way, fussiness and crying may be a late sign. Not for all babies. Some babies cry right away when they're tired. But if you think you can catch it sooner than that, I highly recommend it. So if you start seeing the yawning and the stretching and the rubbing, that's a great time to start with your consistent bedtime routine. So for newborns, you may be swaddling them, singing, rocking, and then putting them down before they're completely out. So when they're drowsy, when you see them starting to kind of drift a little, go ahead and put them down. Because some babies, as soon as they fall asleep, if you put them down, they actually startle back to wake. And that can be really jarring for kids at any age, actually, if they're falling to sleep in a different area and then they wake up and they're in a completely another area, even though that newborn's not cognizantly aware, that can elicit sort of a startle or scared response in the baby. Because as you can imagine, if you fell asleep in your bed and you woke up all of a sudden outdoors on the lawn, that would be pretty shocking. And the same thing, the baby's feeling that same thing. So we just want to avoid that from happening if possible. Daytime, nighttime. So babies are not necessarily born knowing the difference between day and night. And sometimes they can have their schedules confused at first. So it can be helpful to kind of help your baby know the difference between day and night by keeping the lights on and being more active in the day, and then kind of keeping everything low, like lights low, and being quieter during the night as well. So I hope this was helpful. Babies do a lot of very strange things, and I hope that some of you sleep a little bit better at night. If you need any further advice and you are in Asheville, North Carolina, and you'd like to join Middle Path Integrative Pediatrics, please go on my website, because I do have a link that says Meet the Doctor. I think it says Meet the Doctor. Maybe it says free meet and greet. But it's very easy to find, and you can sign up and schedule a complimentary meet and greet and see if we are a good fit for each other. And I would love to do that and see you in my practice. Additionally, if you need a functional medicine consult, ages 2 to 102, I would be happy to see you for that as well. So go to www.middlepathintegrativepediatrics.com and I'll see you there. Wishing you well. Bye, guys.